You spend a fortune on your health insurance premiums, deductibles, gym memberships, organic food, supplements, a cabinet of half-used remedies, and here's the paradox that will make you want to throw your Fitbit into a river. Americans pay twice as much per person for healthcare as any other wealthy nation, and we die younger, get sicker more often, and report worse overall health than people in countries that spend half as much. And it's not because our medicine is bad, but because we've confused healthcare with health, built a system that profits from sickness while calling itself care. And the numbers are a quiet horror. The US spends trillions a year on health, nearly a fifth of our entire economy, yet life expectancy lags behind Cuba and Costa Rica. Maternal mortality is triple Canada's, chronic disease explodes, and half of us are on at least one prescription drug, managing symptoms while the root causes go untouched. And the neuroscience is a feedback loop of despair, because chronic stress from overwork, debt, loneliness, and inequality floods your body with cortisol, weakens your immune system, inflames everything, and then the doctor gives you a pill for the symptom but can't prescribe a way out of the stress. So, you stay sick, take more pills, and the system smiles because, well, people don't buy drugs and procedures. The system wants you stable enough to pay but just sick enough to keep paying. And the American twist is that we've privatized sickness and socialized debt, spectacular at high-tech interventions and spectacularly bad at prevention, primary care, and basic humanity. So you are not a person but a revenue stream with a heartbeat, and you feel it that low-grade anxiety that no amount of insurance quite quiets. But here's the reversal that only fully lands when you stop chasing fix and start recognizing that the healthiest Americans are not the ones with the best coverage or the most supplements, but the ones who learn that health isn't a product you buy, it's a way you live. And the most powerful medicines are free: sleep, movement, vegetables, connection, purpose, and the absence of chronic stress. And they walk instead of driving, cook instead of ordering, talk instead of scrolling, work less and rest more, and none of that appears on a billing statement, so the system has no interest in telling you about it. Let me tell you about Carol, 63, on 7 medications, seen 12 specialists in 2 years, spending $10,000 a year out of pocket, exhausted and convinced she was falling apart, until her doctor finally said, "Carol, most of your problems aren't medical. You're lonely, sedentary, eating processed food, and haven't slept well in a decade. I can't prescribe friendship or vegetables or a good night's sleep, but those will do more than any pill I have." And Carol was offended, then curious. So she joined a walking group, started cooking simple meals, adopted a dog, cut her work hours, and a year later she was off 3 medications and her pain was manageable. Realizing she'd spent 30 years treating her body like a machine and her healthcare like a repair shop, and nobody told her the repair shop wanted her to keep breaking. The American cognitive paradox sits right here. We spend the most and get the least because we've outsourced health to an industry that profits from our exhaustion, and the only escape is to reclaim the small, free, unprofitable choices: an extra hour of sleep, a walk, a real conversation that actually heal. And right now your brain may want to defend your meds and your schedule. But ask yourself how much of your sickness is biology and how much is a life that leaves no room for wellness, because the system will never tell you to rest. The system runs on your burnout, and the first real prescription is the one you write for yourself when you stop renting symptom management and start living. So if something in you just exhaled, if the thought flickered to send this to someone with a full medicine cabinet and an empty life, that's not about me. It's the recognition that health isn't found in a billing code, and sharing that might be the first free intervention you've offered all year. Now go do one thing tonight that costs nothing and makes you healthier. That's an order.